Family planning services are the ability of individuals and couples to anticipate and attain their desired number of children and the spacing and timing of their births. The family planning program is neglected despite being a key pillar in achieving safe motherhood, maternal health, and improved quality of life for women of reproductive age and their families. Some religious sects forbid the use of modern contraceptive methods other than the natural Billings method. This situation has continuously increased cases of unwanted pregnancies and abortions. The Challenge Initiative (TCI) is an exciting new business unusual approach to financing, scaling up, and sustaining high-impact family planning solutions for the urban poor. It is a 3-year urban reproductive health program funded by the Bill and Melinda Gates Foundation. TCI is demand-driven. Local governments self-select to participate and demonstrate political commitment by providing their own financial, material, and human resources. In return, TCI brings technical expertise as well as support from its Challenge Fund. Dr. Barrah, who is the technical support lead service delivery, shows more light.
Challenges we saw. So we started from training the officer in charge, that's the OIC here, the FP supervisor of the LGA. We trained them on that lack. Then the second intervention was now to come here and renovate the facility. And we did this in what we call the 72-hour makeover, where on the close of business on Friday, we start to work. On Monday morning, it was commissioned.
The 72-hour clinic makeover is an improvement in the physical environment of clinics or other facilities that provide family planning services based on priorities identified as part of a makeover assessment. During the makeover, facilities are renovated, refurbished, and equipped for optimal family planning service provision. The 72-hour clinic makeover is the culminating event after providers have been trained or retrained and provided materials for referrals, job aids, and communities have been mobilized. 2 communities that have benefited from TCI's 72-hour clinic makeover are Osa Oke Primary Healthcare Center in Obingwa Local Government Area and Umwala Igbelu Primary Healthcare Center in Abia North Local Government Area, both in Abia State. Comrade Eruba Victoria Choma, the Health Authority Secretary in Obingwa Local Government, said that women come from all over the world to Osaoke to access family planning services at the health facility.
We have other facilities within this place, and this place is strictly populated. Okay. So the services, the client flow. Yes, but we made it in such a way that it will not be difficult for them to access in terms of distance.
Regina Nzwebu speaks on the acceptability of family planning services by women in Osaoke community.
The good people of Osa, I greet you. My mothers, I greet you. We accepted this very well. Our women come for family planning services, just like government has instructed us. They said we shouldn't give birth to the number of children we can't cater for. We've been keeping to it. Those who want to get pregnant, get pregnant. Those who want family planning services still get it 24 hours. The nurses here are doing a great job and they are nice to us.
The men of Osaoke are not left out as they also access family planning services at the health facility.
I myself, now if I'm having sex, I will use a condom so I don't cause problems. The reason you people came is a very good thing. Before now, our women used to give birth to a lot of children.
What is the process in accessing family planning services? First, you have to visit a facility and the OIC, that is, The officer in charge will ascertain what family planning method will be most suitable for you in the privacy of the family planning unit, and then you're ushered into the family planning procedure room where the client receives the service. As beautiful as it sounds, the general awareness, literacy level, and acceptance of modern family planning services and its benefits is still low. Abia State allocates 7.5% of its total budget to the health sector, half of the 15% allocation recommended by WHO. Did you know that 2,345 women in Abia State die from childbirth and pregnancy-related causes annually? Yet, some women cannot access family planning services because of the user fee that needs to be paid. Comrade Eruba Victoria and Ebuta Grace, the social mobilization officer in Abia North local government area, explains this terminology.
It's free actually, but the materials, the consumables we get, how do we provide for it? Okay. Because the workers here are not being given any interest. So when you get commodity, like now we're doing MIMOP, modified implementation, modified medical outreach program. Okay. That's what we're doing, and child outreach combined. They gave us consumables. You manage it so that you use it for other services. Assuming it gets finished, what do you do?
When you come to consumables, that way the problem lies. When you talk about the user fee, the problem is from the consumables. If you provide commodities, TCI have provided us with good accommodation and other things that we need to work with. Government has given us the commodities, but then without the consumable to give a provider all these services, what I need is glove. If the glove is not there, how can I provide it? I cannot give a provider what he or she wants without my cotton wool or without a cotton wool. If the cotton wool is not there, I have the commodity, I have a good building, what can I do?
For clients to continue enjoying family planning services, the service providers require consumables. Who shall bail the cat? Before TCI came to Abia in June 2018, family planning was not considered high priority. Partner support for family planning was negligible when compared with other reproductive health issues, and the state's family planning unit planned activities totally dependent on partner funds. TCI's advocacy efforts led the Abia State government to budget 200 million naira for family planning interventions in its 2019 budget, the first time in its history that the state dedicated funds to family planning. In 2020, the government of Abia State also approved the sum of 145,750,000 naira for family planning in its budget for that year. No release has been made for all these years to support family planning program in the state. This year, 70 million naira has been approved by the government for family planning in its 2021 budget. Will the Abia State government release these funds? These funds, if released, will help in training and retraining of health workers on modern family planning methods, social mobilization, demand generation for family planning through the mass media, community social mobilizers, and other traditional methods. Renovation and equipping of family planning units across the state. Purchase and supply of medical consumables for family planning service delivery. Monitoring and supportive supervision of family planning services across the state to ensure that they are provided in line with national standards. Last mile support of family planning commodities provided by the Federal Ministry of Health. Printing of data collection tools for family planning data capture and reporting. TCI will withdraw their support for family planning in Abia State if the government does not show commitment by releasing funds for family planning. If they do, what happens next?